Everyone, this is a live session on the Hall's technique of stainless steel crown on primary molar. So this is a primary maxillary molar. This is tooth number 65, and we are going to demonstrate step by step on how to do the stainless steel crown using the Hall's technique for this particular tooth. There are a number of steps involved, and doing patients, it is crucial to follow each and every step, so that we save the chairside time as well as we restore to the excellent capabilities or the skills that we have. So the first thing that we need to, when the patient or the child is sitting on the dental chair, and we have already discussed everything about the stainless steel crown with the parents, and if the child knows the things, then the initial thing that we should be planning is the topical anesthetic. The preference could be the gel or the spray type. You may prefer to directly use the nozzle of the spray so that it reaches the interproximal segments, because there might be some irritation that the child may feel, and due to this irritation or the discomfort, the child may not be able to cooperate. So either spraying into the interproximal areas or using the jelly so that it is soaked into the interproximal areas. This should be your first step. Let it act, wait for just a minute or so, that let it act for a while. The second step is not selecting the crown. This is what I believe is doing with the proximal slicing. That is, we need to create the proximal spaces where the stainless steel crown would go. So over here this has some space, this model has some space, but the contacts are too tight in primary molars, the child patient. So we need to create that proximal slicing where the SS crown would go. In such type of cases, this gingiva over here at the distal aspect would be just at the disto or marginal ridge. So you need to have the burr indulge into the proximal aspects at the distal also, so that your SS crown goes easily. So beginning with the second step is you should be able to use a needle burr. So this is TF11, this is TF11 that has a golden grit. This is from President. So this is the second step that we need to do. We need to create the proximal slicing. Remember not to involve the proximal edges of the adjacent tooth, because the pulp horns are very high. So remember to keep it safe as much as you can. You can use the matrix band individually, or the different aspects where you can protect the adjacent tooth. Over here I am using this metric strip, which is easy to engage in the proximal aspect, so that it is protecting the adjacent tooth. Once you can see it now, and this is the time we can go with the proximal slicing, easily protecting the adjacent tooth. So the second step. Keep your burr straight. Just 3/4 of slicing, and you would feel that the contacts are break and there would be slight bleeding over here. You need to address this to the patient initially, that there might be some bleeding and nothing to worry. And on the distal aspect again go, so that this soft tissue is slightly removed, covering the distal aspect, and we could have a 3 strokes. Now this is sufficient. Over here you have already separated the contacts. Now remove your metric strip. You have safeguarded the adjacent tooth. This tooth is safe, and you have already created the proximal spaces for engagement of the stainless steel crown. Now coming to the third step. The third step would be directly selecting the crown based on the major distal aspect. So preferably use the 3M crown kit. 3M crown kit would have a proper snap fit. So start with the lower aspect, that is the lower size, as we have E2 to E7. So see, this is in our, we are in our third step. As you can see, this is E2. So start with this and try to engage it. So you would find that this crown is falling short on the distal aspect, so not covering major distally. So you need to discard it and then move on to the selection with E3. And when we select the E3, it is still not covering the tooth properly, as you can see. Remember, these 3M crowns fit snugly once they are selected in an appropriate size. So just the size 3 has been discarded, and now coming to the size 4. So over here the 4 size comes nicely. As you can see over here, it is covering almost all the aspects. But there is slightly high, so what we need to do is we need to do a slight festooning so that it gets fit snugly at the proximal counters and get seated more deeply. So now we begin with our 4 steps. So the crown selection is done after the proximal slicing, and we have selected E4. Now we would do the proximal slicing on both the sides, the mesial and the distal aspect, so that we could engage it more deeply in a snap fit. So for that we are going to use the acrylic burr. And we would do the proximal slicing with this acrylic burr. Remember to use the top end of this acrylic burr. This would be more easy rather than doing it sideways. Just reducing the speed. And now engaging it. You can use the fine curved scissors also to remove the proximal aspect to do the festooning. This step is called as festooning, where we are giving the gingival counters at the proximal aspects. On both aspects you are going to give it. the mesial as well as the distal. This is the fourth step that we are discussing, the festooning part. See how the contours are created, and see there are the margins are getting the fragments are getting inside, so we need to clean those things also. From both the aspects. So once you are able to clean it on all the aspects, now let us check it on the tooth. See, the snap fit starts to come. Still the crown is not getting engaged because of the restrictions. So you can mark those points where there is restrictions, mostly at the proximal parts. Or you can note down those points over here. And once marked, this would be your point of reduction at the extreme points where you have marked it. Over at the other aspect also. See, I am using the tip of this, not the sideways, and reducing it. Once done, this is the time to see it on the model itself. Remember, this crown should come in a snap fit, and there should be a tight fit. See, there is a tight snap fit. Now you can see the crown getting engaged on all the aspects. As you can see, all the margins are getting covered on all the aspects. When we see from the buccal aspect, we can use the mirror also. See, this is the size E4, and the buccal aspect is covered fine, and the proximal distal aspect is covered fine, the palatal aspect is covered fine. So from all aspects, now the thing to be noted is that this crown is ready to be luted. However, this crown is little higher. It is roughly, you can say, 2 to 3 millimeters high. At least it is just 2 millimeters still higher. Remember not to worry, just when you depress it, now it is roughly 1 to 2 millimeters. So this high crown is okay to do. It would take roughly 3-4 days or a week to adjust on the basis of the occlusion. The occlusion during the mixed dentition phase is in a transition phase and it is continuously changing. So nothing to worry, this is an Hall's approach. You may prescribe the analgesics to give some relief to the child, and the things are done. This is the final thing that you could use the luting cement and finally cement the crown. Hope the things were simplified in the best possible way so that you can easily understand the Hall's approach, that we have not reduced the tooth, we have only did the proximal slicing. We created the space proximally, we protected the adjacent tooth, and we are ready to give the Hall's crown. Still, if you want to learn the things step by step and any special steps or the technique that you want to learn, we have a membership program where you can consider joining and give your topics or the things that you want to learn, and we are ready for that also, considering that membership session. And thanks for watching. So finally we seat this crown in a snap fit. So thanks for watching. If you have any queries, you can ask in the comment section below this video. Bye bye.